Every year, more than 500,000 Americans undergo procedures to have a narrowed coronary artery propped open with a small metal mesh tube or stent. The polymers used in these stents are non-biodegradable, and they have stainless steel components, both of which are linked to increased risk of complications. But a new generation stent is available at Baylor Heart and Vascular Hospital, the first site in North Texas to offer them. Dr. Stoller, one of the real challenges in treating cardiovascular disease is preventing clotting, especially in stents. Talk about how you're entering a new phase now in the treatment of this and finding a way to prevent these clots.
So when we started putting stents in people's coronaries back about 15 to 20 years ago, stents would still grow blockage back inside them about 25 to 30% of the time. We were one of a number of sites that helped pioneer and do the clinical trial on a new generation of stent that has what they call a bioerodible polymer. And what that really means is, over time, over about 3 months, the polymer dissolves. It completely goes away. What we're hoping, and we're beginning these clinical trials, is that these new generations of stent will allow us to cut the clopidogrel use down to 3 months, or even maybe hopefully 1 month in the future.
Why is it so important for us to cut down the amount of blood thinners that you use?
Because a lot of patients that we treat are older or have reasons that they might bleed. For some patients, it's simple enough as they're elderly and frail and thin-skinned, they bruise easily, and this is a problem for them. Just having the ability to shorten the duration of that second blood thinner gives us a lot of options when issues come up down the line that we might not foresee.
What has been your role in this research and trial?
I'm the principal investigator here at Baylor, and I've been a co-author on one of the papers. So we have extensive experience using it. We're a top 10 enroller, and we're using it on a regular basis now where it's appropriate.
Available for anyone?
Available for anyone. The way we like to describe it is the best way to be able to treat all patients is to have the biggest toolbox that we can to be able to offer whatever particular device is best in whatever situation for the patient.
For more information on this biodegradable coronary artery stent, go to BaylorHeartHospital.com.